For parents, managing screen time is part of the job.
We don't necessarily limit time frames. It's really more as long as if they are active.
All about moderation, it's time outside, time reading, time on the iPad, electronics.
The worry,
Come on, let's go.
not just how much time they're spending on it, but what the screen time is doing to their bodies.
I've seen my kids literally stretch out after they put their tablet down, and it's obvious, yeah.
Tonight, doctors in Metro Detroit are sounding an alarm about the types of injuries they're seeing in children because of screen time, injuries they don't expect in children.
And we started hearing about this from doctors during our weekly check-in with area hospitals for what's going around reports of area illnesses. Kimberly Gill sat down with some experts from Children's Hospital of Michigan. This is critical because obviously this is a short-term, a long-term event. And
it really is.
I know I struggle at my house.
If you've got kids, it really is one of the many challenges in being a parent in today's society. You need your young child to sit still so you can complete a task. So you give them a phone or a tablet. I do it myself with my 5-year-old. It seems harmless, but doctors say what makes life easier in the moment is creating problems that you'll have to deal with later. And surely you've heard about attention problems with too much screen time. But now medical professionals are seeing problems in children that they usually only see in older adults.
Dr. Josh Gatz is a pediatric sports medicine physician at Children's Hospital of Michigan. He's concerned with a trend he's seeing in his practice with children and their physicality.
We're starting to see a lot of kind of muscle ailments, soft tissue ailments from kids who are particularly inactive. We're starting to see kind of muscle knots, muscle spasms, things that we might typically see in adults.
And this is specifically coming from, you believe, the positioning in which they are on a screen.
I think it's kind of multifactorial, definitely one of them.
Dr. Gatz says he's seen kids in the ER after they've fallen asleep while looking at a tablet, only to wake up and not be able to move their neck or their arm. It can lead to missed days of school and even physical therapy in pediatric patients.
We're starting to see these types of ailments where they're having limited range of motion, they're uncomfortable in school, it's starting to affect their daily lives.
Donna Dotson is a senior physical therapist at Children's Hospital of Michigan.
We're seeing kids with difficulty with focus and attention, seeing many kids with issues with visual tracking, which impacts your general functioning and then particularly with reading. Delayed development, delayed walking skills, delayed crawling skills, delays in sitting ability, difficulty, delays in communication skills, increased anxiety because of screens. And so these are all areas that are impacted by an excessive amount of screen time.
And you've been doing this for 30 years and you feel like you're seeing it more now than you were, maybe 15, 20 years ago.
Absolutely. The screen time for our population in general has been steadily increasing over the years, but the COVID lockdown kind of pushed everybody over the cliff where everyone got in the habit of relying on screens and spending a lot of time on screens. And so particularly since then, we're really seeing a lot of kids that are getting too much screen time. And so it's become such a crisis, and it's really frightening the effects that we're seeing, so that we are now having this discussion about screens with every family that we see.
Dotson says many families don't realize screens are even a problem. And not only that, some have forgotten what to do when there's not a screen involved, and how developmentally appropriate it is for kids to be, well, kids.
For example, when kids come here, I don't want them sitting quietly, well behaved in the waiting room on a screen. They need to be trying to climb on the furniture and the parent having to say, no, you can't do that, you have to sit down, and trying to run around and no, you can't run in here, you have to walk. Children's development doesn't happen because time passed. It happens because they had a lot of practice. And those are opportunities in the absence of screens to practice.
Medical professionals are asking parents more specific questions about their kids' use of screens and providing information on how much screen time children should have. But most of all, they're encouraging more play.
In Michigan, it can be a little difficult when it's cold, but even still, finding potentially youth sports in the winter, things like that, to stay active. Even just 30 minutes, 6 times a week, one thing every night, even just going out for a walk around the block with the family, trying to get away from those screen times, just being active.
Play is the work of a child, and they have a bunch of these handouts at Children's Hospital that they give to parents that have guidelines about screen time and reminders about some of those screen-free activities you can do with your child. We put some of these up on clickondetroit.com. We really underestimate the power of the games that we used to play as kids, like red light, green light, and freeze tag, and just kicking a ball. Those are all things that, you know, now that you have screens, you just don't even
grab your phone.
Exactly. That
I liked
we're not
his
doing.
example about the waiting room. Like, you know what? Learn how to sit or climb on the chair.
Exactly, and that in itself is something that children need to practice. You just shouldn't, you know, give them. They recommend against giving them just a screen just to sit still. So.
And you were hearing that we're going to hear more about this as the weather warms up.
You're right. So I interviewed a doctor, a pediatrician, who says this really starts to show up during the spring and summer months. So coming up at 6 o'clock, you'll hear from her and her concern, because we're talking about what she calls older people problems in children that she's seeing in her practice. So you'll want to stick around for that because of this. Yeah.
Look forward to it.
Thanks, guys.
All right. Thanks, Kim.